Two of the most common procedures that we do nowadays are inguinal hernias and any abdominal wall hernias really. We do a lot of laparoscopic procedures, and actually nowadays we're doing a lot of our procedures using the robot laparoscopically. There's actually been more robotic laparoscopic cases performed in 2023 than regular laparoscopic cases, and we have these capabilities at all of our hospitals. I really like doing procedures using the robot. We do a lot of inguinal hernias in the robot, a lot of gallbladders. With the robotic procedures, patients they have less pain, they're up and moving around a little bit quicker, using less narcotic pain medication, which is always an advantage after a hernia operation. They seem to recover just a little bit quicker. My favorite part of my job is when I see the post-op patients and see how well they're doing and how they're amazed at how little pain they had after their robotic laparoscopic procedure. Well, people should choose UVA because they're going to have a good experience and a smooth experience going through our office, from making the appointment to scheduling surgery to seeing us in the office and their post-op care. We treat every patient like we would treat our own family.